Are you a difficult patient? It's a bit of a controversial question, if you ask me. It's a tough question to ask. Almost seems wrong to ask that question in a way, right? Because by virtue of being a patient, I'm a patient, you are a patient very likely. By virtue of being a patient, we're seeking out care, we're seeking out help, we're seeking out guidance. We might be well, but we also might be sick, we might be suffering, we might be in need. And it seems hard or maybe even wrong to ask if someone who's already in a difficult position, potentially, is difficult. But I'm going to ask the question, are you a difficult patient? I'm asking that question because I recently read some articles, some geared towards doctors, some geared towards patients and the public, about what a difficult patient is. And I have a few thoughts. There are roughly 5 characteristics that I would define or call someone as being difficult, or sort of maybe say a patient is being difficult if they are this, but there are reasons. I'm going to tell you what those are. I'm also going to tell you the qualities and attributes that I don't find difficult in patients, although maybe others do. I also need to remind you and to remind us all that doctors can be very, very difficult. This conversation is not to remove doctors from the equation. First of all, you should know even before I start that I'm with you. I'm on your side. And I'm hoping that you actually might be pleasantly surprised when you hear my thoughts about this. This is not to remove doctors from our responsibility, our role in even how you feel or act. Sometimes, perhaps, a patient's difficultness, if one could even say that, may be because of the doctor they're dealing with. So I have plenty of videos on doctors behaving badly, and I've got plenty more that will come. Many would say that difficult patients are maybe patients who, and there's a long list. This is not comprehensive, but these are things I've read in some of the articles I've read, maybe conversations I've had or overheard with my colleagues, etc. Difficult patients. What could difficult patients be? Maybe a patient who is overwhelmed, a patient who requires constant reassurance, a patient who contacts us a lot, or a patient who asks for explanation, or maybe has lots of questions when we're in the office, maybe has a list of things and they want to go through, they want to be meticulous about things, they want to make sure they understand, and maybe they come back to us to make sure they understand. Any and all of those types of patients could be deemed as difficult patients by some. Let me tell you what I think about those patients. First of all, I don't think patients with any of those qualities are difficult at all. First of all, it's okay to need reassurance. Who doesn't need reassurance at some point? And hello, we're doctors. That's what we're here to do in many ways and when we can do it. And you guys know how I feel about the idea of taking charge of your medical care and getting questions, answers that you may have, and making sure that you understanding stuff. You come in with a paper and a pencil, I am never, ever, ever going to condemn you for that. It might take me extra time, but thank goodness that is who you are. Those are excellent qualities. Okay? So don't ever think, and what I'm saying is those are not difficult patients. Okay? They're not at all. And I think sometimes when, the articles and things that I've read, when physicians or healthcare providers are talking about difficult patients, maybe it's because it takes us extra time. Maybe it's because we can't move on so quickly or what have you. Maybe it's because we can't get away with just sort of saying a few words, blurting a few things out and running out the door. Not here to condemn my doctor colleagues either, but I'm just saying that I think that the perception of difficult, you got to really consider the perspective. You got to consider the source. So, but I'm saying this to patients, to you all, my people. If that's who you are, there's no issue there for me. Some people may say that difficult patients are those who are grieving, upset, anxious, I mentioned, even angry. That's not difficult to me. You might say, well, hey, angry, what's that about? Well, no, I've got some takes on anger, but angry as an emotion does not make you a difficult patient. I mean, given some of the things that my patients have going on in their lives, some of the diagnoses that they have, that they've been given to no choice of their own, I'd be angry too. That's not a difficult patient. That's called a human patient. A human who's dealing with what they're going through. Being upset, hello, have you seen the world that we live in? No, that's not being difficult. It's being human, living in the world that we live in right now. Being scared, not a problem. Grieving, not a problem. those things are difficult. And I think there's probably actually a whole longer list of things that I couldn't think about. Like I tried to make my short list of things that I don't consider difficult. I think there are plenty of other things that go on that list. Okay, that's not difficult, meaning that's not a difficult patient. That is a human patient. That is when we are human. I will tell you 5 traits that I do consider to be difficult, but I'm also going to tell you why I think they are difficult. Okay. One is a patient who's manipulative. That is a difficult patient for me. I'm being very honest. I'll never forget some years ago, long time ago, a patient came in and really complained of sort of cold symptoms, but her cold symptoms, like upper respiratory symptoms, but her upper respiratory symptoms really were not much of anything at all. There weren't really many symptoms at all, had not been going on very long at all. And by definition and how we practice medicine did not warrant an antibiotic. And so I explained this, and I also explained what I thought we should do, things that we could do to help her body get over what I thought was a virus, etc. And the patient was disappointed and actually upset and a bit angry and frustrated that I was not going to provide an antibiotic. And she said to me, she says, what would make me get an antibiotic? Well, what would cause me? I said, well, generally if the symptoms are this long, or if the symptoms are of this level, or if the symptoms do get worse, or I sort of discussed the criteria that often we go by as doctors to sort of make our best guess about who might need an antibiotic with an upper respiratory infection. And then she sat there and she says, well, let me tell you about my symptoms again. And she proceeded to tell me everything I just said that would warrant an antibiotic. And I didn't know what to say. It was manipulative. It felt like a kick in the stomach. It's probably one of the more difficult encounters I've ever had because it really has been the only encounter I've had like that. Manipulation, and that's at least how I felt at the time. I felt that the patient was being manipulative. That's my opinion. That is a difficult patient. That's a difficult patient encounter because it doesn't feel honest. It feels like it's happening, or at least that encounter felt like it was happening for secondary gain. And that lack of honesty and truthfulness makes that difficult for me. So that perhaps, I guess, is a difficult encounter, maybe a difficult patient, that patient encounter. Another one is when patients lie. Now, we lie for lots of different reasons. I'm not saying that lying is bad or wrong. I'm not here to make a moral judgment about lying. That's not what I'm here to do. And I'm not saying it's difficult because, lying is bad. That's not what I'm saying either. What I am actually about to say is that when my patients are not truthful with me, I can't take the best care of them. That's why that's difficult. That's a difficult patient encounter, and perhaps a difficult patient because I can't take care of them to the best of my ability. If I don't know what's going on or what's really happening or what's not, I may make medical decisions for that patient based on false information, and that could put them in harm's way. That is difficult. That's a difficult encounter. Number 3, a patient who threatens me, a threatening patient, or threatens my staff, or threatens anyone. It's not just me. That's a difficult patient, right? That's not okay. Okay, whether it's physical threats, whether it's violence, whether it's threats, being threatened. That is not a situation I want anyone to be in. So yes, I call a patient who threatens me or threatens my staff or threatens others. I consider that difficult. I do. I would say number 4, patients who don't take care of themselves often are considered difficult by many doctors. And I am along those lines too, but not for the reasons why you might think. Those are difficult encounters for me because, number 1, I know that if someone's not taking care of themselves, going to dialysis, taking their meds, doing this and that, I know there's a reason. Whether or not I know what that reason is. It could be a cost issue. It could be fear. It could be depression, anxiety. And if they're not taking care of themselves and I can't figure out why, I can't help them. Also, if a patient is not taking care of themselves, it ultimately may mean that they're hurt in the long run. Those are difficult patients, not because I'm saying they're bad people. It's because I'm saying there's often some reason, whether I know what the reason is or not, or able to help with that reason or not. And also, it ultimately may do that patient a lot of harm. It just means someone's going to be sick if they're not able or not willing or not taking care of themselves. That's why that's difficult. And I would say the last sort of difficult patient encounter is one where a patient is mean or rude, not for the reasons that you guys are thinking, okay? Because once again, when patients are mean or rude, there's usually and often a reason. Maybe they're scared, maybe they're worried, maybe they're overwhelmed, maybe they're frustrated, maybe we did something wrong and they're appropriately mad. The thing, though, about being mean or rude is that, I don't know that patients, I have a few patients that, in the past too, patients that maybe are not actually the nicest to me, consistently, just not very nice to me. It happens. And I don't know if patients realize it actually just hurts my feelings. Now, I'm a little bit of a, I wear my heart on my sleeve. I'm a little bit of a sap. You guys know who I am. It actually just hurts. Like, my feelings get hurt. These days, it's not just saying it's a difficult patient if they're a bad person. No, I'm just saying when patients are mean, it hurts. We don't want to see you mad or angry or upset. And maybe when you're mad, angry, upset, and you say certain things or say certain things in a certain way to me or my staff or people I work with, for me, it just hurts my feelings. And it makes it difficult because it hurts and it's tough. So, those are my sort of 5 difficult patient encounters, but those are also the reasons why those encounters are difficult. And I think that when it comes to thinking, are you a difficult patient, it's really not the right question to ask. That's the question that is asked. It's in articles. You can Google that question. There's lists of what makes a difficult patient. There's a lot of that, but I think it's more than that. I don't think it's as simple as that. So I guess I want to know what you think. And this is a topic I've thought about doing for a long time. And here it is. I want to know, what do you think? I want to know, did I leave out something? And I also want to remind you, oh no, this does not exclude the doctor. For those of you who may have tuned out for a little bit of this, no, I've got plenty of videos on how doctors behave badly. Oh yeah, this is not one-sided. This is just the topic of the moment. So let me know what you think. Know that I'm on your side, though. We're in this together. And I always encourage you to tell us healthcare professionals what we need to know and how you're feeling and what you're going through. And I've always said this and still will. It is our job to help. It's not our job to make things worse. It's not our job to judge. It's not our job to condemn. It's our job to help. So if we're not doing that, communicate that with us. Guys, okay, that's that. Maybe I'll continue this if I think of more thoughts that I didn't get to express here. But let me know what you think. I'm Dr. Jen. Hey, let me know what you think. Subscribe to my channel. Click the little bell for updates. Check out my website, drjencaudle.com, for my health newsletter. Guys, talk to you soon.